The only constant these days is change when we look at vaccine supply expectations and processes at both the state and federal levels. I know this only increases confusion, frustration, anxiety, and fear, and that often erupts in both misinformation and anger. Our frontline workers, our volunteers are vaccinating every day, and we're trying to very quickly pivot our local processes to adapt to these changes. The New River Valley, we've built a very efficient and equitable distribution system thanks to our local and regional resources. And we're committed to following the prioritization and protecting our most vulnerable, supporting health equity, and supporting our critical infrastructure. Those are really parallel processes right now. We do have the capacity to increase our vaccination volume, but we still have a much greater demand than we have supply, and that's for the foreseeable future right now. We're all frustrated, we're all tired. I'd like to ask our community to exhibit the collaboration that we are known for in the New River Valley. We need to change the conversation from a frenzied search for a vaccine or a sense of injustice about vaccine delivery to how we can help each other get through right now. I am going to ask that everyone who's lashing out in anger consider, one's own fear and anxiety, and take a moment to think about how you're treating our volunteers on the other end of the phone or the recipients of those emails. We've all been stressed by the pandemic. We're at a year now. And I will say that the numerous staff and volunteers in this effort are doing the best they can with what they have amid the ever-changing tides and the uncertain circumstances, and that there's so much that's really beyond our control. The pandemic's taken a huge toll on our collective mental health, and we need to really ask to show each other some grace and to look out for one another. New River Health District, we are deep into phase 1B. We're vaccinating our people 70 and older, our congregate living situations, and our essential workers. We are starting to schedule people under the age of 70, between 65 and 69. Younger people are getting vaccinated most likely because of the jobs that they do, and this is not because of favoritism or injustice. And we're going to ask that everyone cheer every vaccine that's given, even if it's not in your arm, because every dose is a shot against this pandemic. Every dose is a dose closer to herd immunity, and that's what's going to get us out there. That's that light at the end of the tunnel. We are asking people to check on our elderly neighbors and friends, help them sign up if they aren't internet facile, if they don't have access. We're doing outreach. We're relying on our community partners. We're trying to get everyone signed up, as quickly and efficiently as we can. But for our elderly neighbors, if you know of somebody who has not been reached out to get an appointment, please let us know. Please help them sign up on our NRV Road to Wellness website. We're asking our religious groups, our volunteer organizations, neighborhood associations, everybody to help us make this a priority with our older population, because we know that they're the highest risk of bad outcomes from COVID-19. We also know right now that there's just not enough vaccine for everyone who needs it or wants it. And we get that. We understand that, there are people who really are at risk. And unfortunately, with the supply not meeting the demand, we have got to prioritize those at higher risk. So we're continuing to ask for patience during this very challenging time. And we have to remember that about half of our population now qualifies in phase 1B. So if you do qualify in 1B, we're asking that you help us become part of the solution. We are expanding our partnerships with local pharmacies and medical providers to provide vaccination, and this is going to help us ultimately as vaccine supply increases. They're critical to expanding our capabilities, and they're also critical to getting to our elderly population, closer to home with someone that they know and they trust. But during the past couple of weeks, we've had a significant number of people, and this is going around on social media to just get on every waiting list possible. And what that's done is it's created a tremendous bottleneck for our partners and for the health district. And it's diverting resources from giving vaccines to executing multiple calls and rescheduling, because people are on multiple waiting lists. And once they show up for a vaccine or they call to cancel an appointment, it takes us time to cancel and reschedule, and then get people, on the back end. we've had at least 750 people who've already had appointments and accepted a first dose appointment elsewhere with another provider. And that's cost us about 400 additional hours that could not be used in scheduling people forward who don't yet have an appointment. So please, if you have an appointment, you're going to get your vaccine. Keep that appointment and don't seek a better choice or a better option, that might be a week or two earlier. I'm asking that everyone be part of the solution and let us do the appointments as smoothly and efficiently as we can. Last Wednesday, Governor Northam said in his press conference, if you jump the line, you're taking that spot from someone who needs it more because of their health condition or because of the job they're in. We have to trust each other to do the right thing. And, I'm asking everyone to do that same thing right now.